Postpartum psychosis is a complication of pregnancy, and it is not common in the baseline population. It affects 1 or 2 women in 1,000, more or less, that have a baby. It is quite sudden and it can be quite severe, and it is considered a psychiatric emergency, and in the vast majority of cases it will require treatment in hospital, and part of that treatment is very likely to be medication as well. The way that postpartum psychosis manifests itself is with intense mood changes. Sometimes it can start with very intense anxiety that goes up and down over the first few days that the illness is developing. People can develop very unusual and bizarre ideas that are not rooted in reality about themselves, about their baby, about other people around them, and they will lose touch with reality, which is fundamentally what psychosis is. It really affects the way that people can function, the way that they can look after themselves and look after their baby, and that's why it needs to be treated in hospital, because the functioning of that person can be so impaired. The ability to focus and concentrate can really be affected, can change very quickly, very rapidly. People can suddenly feel not just anxious or scared, but literally paralyzed by anxiety. And very often the change is so quick and so sudden that people go to A&E to see someone in an emergency because they are so worried about what's happening to them, or someone in their family, someone who lives with them, will encourage them, will accompany them, because they are so worried. What tends to happen is that because it's so fluctuating at the beginning, people might find that after a few hours they feel okay again, and it takes a few trips to A&E before it is actually recognized and diagnosed. There is increasing awareness, of course, so it's becoming easier to recognize it as soon as it occurs. But if you find that all of a sudden you can't really think anymore and you feel really frightened, or your mood has some really significant ups and downs, which is not a common feature for you, then the best thing to do is to get advice as quickly as possible, and that may well mean going to the emergency department. Treatment for this kind of condition, because it happens either when women are very close to delivery or immediately after, in the days or weeks soon after, needs to be in a specialist environment. And that specialist environment should be a mother and baby unit, where women are treated by a team of perinatal specialists that can help them continue to look after their baby and continue to bond with their baby, while the changes that are happening to them, to their bodies, are also taken into account in their treatment plan. That is the optimal care pathway to start their recovery. Sometimes it takes a while. It's such a intense experience that it might take a while to fully recover from it, and part of that recovery may be later in the community, at home with a team of community specialists. The other thing that I really want to say, the message that I want to give, is that it is a treatable illness. With the right treatment, it can resolve quickly, and that's why it's very important to get advice as soon as possible if somebody's worried. And the other thing that I will say is that although it is not common in the general population, the risk of it happening is much higher in specific groups, such as people who have had postpartum psychosis before, or people for whom it runs in their family, and people who have a diagnosis of bipolar disorder type 1, because their mood is more likely to fluctuate and they are more likely to have psychotic symptoms, and that increases their risk of this particular complication happening in pregnancy. For these people, there are perinatal services that can make sure that their treatment plan in pregnancy includes a psychiatric component, so that they can be monitored and any change is detected early and their treatment is adjusted so that they hopefully don't experience a full relapse. It might vary depending on the person, but something that's very common is sleep changes. For anybody who has these diagnoses or suspects that they might have a mood disorder, I would strongly encourage them to talk to a perinatal psychiatrist and have a preconception assessment. So if they think that they want to plan a pregnancy or that they may in the future want to become parents, it would be very helpful to think of that also in the context of what it can mean with their family history or their own history, their own diagnosis and their symptoms, to make sure that when the time comes, their care can be optimized and that they know what it will look like, because again, knowledge is power.